Alright, so here is our goodie bag with mouthwash, some reach flossers, a toothbrush, and a few different types of toothpaste as well as floss. But I wanted to show you before you left the technique for brushing your teeth. So I know you use an ultrasonic, right?
Yes.
Okay. You use ultrasonic. Now, even though it provides the power for you, you don't want to press too hard because you would just be pressing at your enamel a little bit too hard, so it provides the force for you. So with the electric toothbrush, always just angle it to about 45 degrees toward the gum line. So you don't want to be full on just because you don't get that gum line, and plaque likes to rest just up at these curves right here along our teeth. So then with your Sonicare, you just head it toward the gum line and small circular motions across the whole way. Switch positions and go all the way to the back. Now with the Sonicare, these are the hardest places to get in the back. So maybe you can tip your toothbrush down, that way you can get the tip back here, and that way some type of bristle or mechanical force is taking that plaque off. So calculus and plaque loves to sit on these spots down here. So do the same thing for the lingual. You're going to be facing the toothbrush toward the gum line, and you're going to go all the way around. Now for the front teeth, just like I said in the back, you're going to tip your bristles downward. That way you can get that line angle. That way if you do it this way, you're not doing anything. So this will be the more efficient way. So angle it. So that's for brushing. Now, not everybody loves flossing, and I know you're a 1 to 2 a week flosser. We want to get that higher because one place plaque and bacteria loves to hide is in between each tooth. Okay, so flossing hurts, but most of the time it hurts because we're not doing it correctly. So the correct way to do it, and you can either wind up the floss between your fingers, that way you can stick just fingers into your mouth instead of your whole entire hand, which wouldn't fit in your mouth. So fingers, and then stick just fingers in your mouth. That way you can get back here. So then when you're getting in here with your fingers, you're going to want to do a C shape. So C shape means getting in there, you're getting into the contact, and then you're rounding the tooth, moving back and forth. So you get into the tooth, and then you're rounding it and moving it back and forth, back and forth. Okay? Let's see if I can show you a little bit better on an anterior tooth. Just like this. Lightly squiggle it into the contact, and then C shape. All the way up to the gum line. Be very gentle because you don't want to hurt your gums. That's where the bleeding comes. The more you floss, the less bleeding is going to happen. And you're going to remove more plaque, more bacteria. That way calculus doesn't build up, which is the fun stuff that I took off today. Okay, so let's floss. Now the reachers that I gave you here, same kind of idea. These are a little bit more straight, but when you wiggle it in, just kind of move it back and forth. You don't want to just go boom, 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 like straight up and down. It's not really going to get anything out. Do you use mouthwash?
Yes.
Okay, you use mouthwash. So I gave you 2 types of mouthwash today. Listerine Coolment. This one is really good for gum disease and gingivitis, which is a sign of bleeding. So today you did bleed a lot, so I would recommend flushing your mouth with this every day, and if it seems to help, you should get a bigger bottle. This will help reduce that inflammation and the amount of times you bleed. So bleeding is no good. We don't want bleeding anymore. This is just a total care to help with preventing cavities and restoring enamel, just like our fluoride treatment. It makes your teeth stronger. So mouthwash is a good supplement to add into your regimen for home care. So you always want to brush twice a day, 2 minutes, and I know your Sonicare has a timer, so you're good there. Be sure you try to floss every day if possible. I recommend just doing it at night before you go to sleep, because that's the longest time you spend not doing anything and things are just sitting in your mouth. So try to floss before bed. You do have an air flosser, right?
Yes.
Okay. Use your air flosser. Air flosser is the best way. If you don't want to take the time to floss, or you're in a hurry, or you want to go to sleep, 60 seconds, that air flosser just blows away that plaque and bacteria that's just sitting between your teeth. Quick 60 seconds and you're fine. You don't even have to go lingual. It's a great way to help healing in your mouth. Okay? All right. Let's go. Okay.